pleased to introduce Michael Bergeron as our first presenter. He's the Executive Director of National Youth Sports Health and Safety Institute, and also a professor in the Department of Pediatrics at the Sanford School of Medicine at the University of South Dakota. He's also very active in the American College of Sports Medicine, and is currently a member of the National Federation of State High School Associations Sports Medicine Advisory Committee. So please join me in welcoming Dr. Bergeron.
Thank you very much, Jay. It's a real pleasure to be here. Art, thank you so much for inviting me to this beautiful grounds. It's been a real pleasure. What you didn't tell me, though, is I was going to have to follow your guest speaker, Noah, this morning. I mean, he set the bar pretty high, so a lot of pressure here to now capture your attention. So Art asked me to talk about two things in this presentation. One, to sort of orientate you to this National Youth Sports Health and Safety Institute. We're a new institute, so you may not know too much about it. But then I wanted to sort of focus on one of our strategic areas that would make more sense to fit into this session here about injuries. So we'll cover both that. The first part will be the introduction about our institute to kind of give you some insight to what we're all about. In 2011, we did a national survey, and we weren't surprised by this, but pretty much expected that most Americans, over 90% of adult Americans, felt that sports participation is important for children and adolescents as part of their healthy, active lifestyle. That, again, no surprise. We hoped we would find that, and that was great. But even more so, these adults that we surveyed felt that more needs to be done to ensure the health and safety of youth who are participating in sports programs. So we announced on Capitol Hill the National Youth Sports Health and Safety Institute, and this is an outgrowth of American College of Sports Medicine. So we are the voice of the ACSM on any issue that relates to youth sports. And so in this announcement, we had a wealth of organizations that were there. It was really great, a lot of participation, a number of notable organizations, the CDC, the President's Council, and a host of others. We also had, in addition to myself in this announcement, and Jim Whitehead on the right, he's the CEO of American College of Sports Medicine. We had Congressman Mike McIntyre and Senator John Thune. So again, great representation. Both of these persons are real enthusiasts about sports. And our mission is pretty simple. You know, as it says here, you know, we want to advance and disseminate the latest research, evidence-based education, and make recommendations and policy so that this process for kids who are going through youth sports is healthier, is more safe. The whole development process of kids going through this would be a better process. And to overall, quite frankly, just enhance the experience for kids. And I want to make the point that it's important to appreciate that us at the Institute, like all of you here, are huge fans of youth sports. But there's some problems, and we all recognize some of the problems, and kids, unfortunately, are paying the price for those problems. So there's a big need for this institute. Following the announcement in Washington, D.C., we also made an announcement at the American College of Sports Medicine annual meeting where we highlighted our plans and intent to develop a new model for youth sports. And this is not an easy undertaking, as you might imagine, but we feel that there's a better way to do it, and it's going to take a number of years to get people to buy in and to really craft it carefully so that it's accepted. But we really feel that this is our call to action to put out and put forward a new model for people to follow. As we look at what kids are facing in youth sports, there's really 4 areas, and not the only 4 areas that are challenging kids who are involved in sports, but we highlighted 4 urgent areas of focus that we want to focus on. Sports trauma, which would include concussion. We'll hear a couple of speakers talking about that following me. Environmental challenges, the heat, exertional heat illness, for example, where kids are still dying on the football field, and thousands of others are this close to it. Overload, overuse injuries. I'll talk about that in the latter half of my presentation here. And then what about kids with various disabilities, either physical disabilities or clinical disabilities, whether it's exercise-induced asthma, sickle cell trait, type 1 diabetes, or whatever, that these areas are also important. But for us to really advance on these fronts, we don't want to be just like a lot of the other organizations that are out there, and if you search the web, it's filled. there's a lot of awareness organizations who have heightened awareness about safety in youth sports. We want to do that, but we also want to be a lot more comprehensive with our education, with our outreach, with making evidence-based recommendations and guidelines and real policy changes, but as well be instrumental in advancing the research. And ultimately, we hope to get to a point where we're actually assessing young athletes within the Institute. Again, so it's a very comprehensive vision, very bold vision, and it's going to take some time to get there, but we're pretty excited about it. As well, to really be effective, we can't do it alone, as all of you here appreciate. We have to partner. With a number of stakeholders who have a vested interest in youth sports. We have a close partnership with the Datalist Center. Those of you not familiar with them, they're the ones who have taken over the NCAA injury surveillance. They do a lot of injury surveillance for the National Athletic Trainers Association, their Native Nation project. We've also begun some discussions with the NCAA, which might sound a little odd, but since they've hired their new chief medical officer, Dr. Brian Hainline, he's broadened the scope of the NCAA to include youth sports and looking for that healthier pathway to collegiate sports, because the collegiate Division I athletic directors will all tell you they're getting damaged goods. They're seeing medical histories like they've never seen before. So the NCAA is interested in broadening that. Jay, you mentioned the National Federation of State High School Association. I'm on their Sports Medicine Advisory Committee, so we already do a lot of work with them. And we oversee the health and safety of all 20,000 high schools across the nation, all 18 sports. And a host of other organizations have already expressed some interest, not the least of which is the American Medical Society for Sports Medicine and the American Academy of Pediatrics. So we're really excited that they want to partner with us. I mean, they have a lot of the same interests, and so we're really thinking about, overlapping our efforts and so that we have one voice together, which is, again, very, very exciting. We have a leadership board that is 10 people that are pretty notable leaders. There's 3 of them here who are past presidents of the American College of Sports Medicine. We have a former Olympic champion, Gary Hall Jr. Those of you who don't know him, he was the Michael Phelps of a generation or so ago. Multiple gold medals, multiple other Olympic medals in swimming. And we also have Representative Mike McIntyre that I mentioned before from North Carolina. He's a 9th term congressman from North Carolina. He is the co-founder and the co-chair of the Congressional Caucus on Youth Sports. So it's really important to align with him to get us closer to some of the federal initiatives that we want to be involved with. And what I want to show you is a 1-minute video that does have sound and does have video, where he was actually on the House floor following our announcement to ACSM about our call to action, and he gave us a nice shout out on the House floor. So that's kind of a nice thing, and I just wanted to share with you. It starts with just the sound for about 5 seconds, and then it goes into the video.
Appears to speak for 1 minute. Permission to revise and extend remarks.
No, without objection, gentleman is recognized.
Thank you, Mr. Speaker. I rise today to recognize the work of the National Youth Sports Health and Safety Institute. I'm pleased to serve as an honorary member of the Institute's leadership board. In the United States, 50 million children participate in sports. Sports programs teach our children leadership, sportsmanship. They help improve academics and promote fitness and wellness for a lifetime. But more needs to be done to ensure their health and safety of our youth athletes. They are increasingly susceptible to injuries, and that's why the Institute's work to advance and disseminate the latest research in keeping our kids safe on the field is so critical. On June 1st, the National Youth Sports Health and Safety Institute met to launch a new call to all youth sports stakeholders in America. And as founder and co-chairman of the Congressional Caucus on Youth Sports, I applaud this effort. As inactivity remains alarmingly widespread, we must continue to expand sports and recreation opportunities that promote physical activity, wellness, and the health of our children, but also always remember that their safety must remain paramount. I yield the remainder of my time.
The gentleman yields back.
So that was really cool for him to do that, and obviously that helps us get our name and recognition and really paves the way for us to do a number of things. Following that announcement, we've also done some work with the Congressional Fitness Caucus. And so this was some photos from with Representative Bilbray and Representative Kind, who sponsored this congressional briefing, which followed the Lancet series that had been mentioned yesterday on physical inactivity in the global crisis. So, our role there was to work with the caucus on what role can youth sports play to challenge this inactivity crisis worldwide. So again, it's another opportunity for us to make effective change at the federal level. So what is it about youth sports that is the problem? And I think anyone who's been involved in it, or certainly as a parent, I think you probably recognize it. But overall, as you look at the youth sports culture today, you really see more of a process of exclusion versus inclusion. In other words, so many things about it are you get a lot of kids that start out at a young age, and then for a number of reasons they fall off, and the participation rates go down, go down, go down, go down. And so by the time they get to 16, 18 years old, there's so few people that are involved in those sports. Part of it is because there's such an urgency these days for specialization. So they're looking for kids to pick their sport early, and the focus is just on that. There's year-round training, competition, so we talk about injuries, they're getting hurt. A lot of travel is often required if you're going to get into the game and get on these travel teams. Very, very expensive to do that. Really what kids are following is truly a professional development model. In fact, they often work much harder than professional athletes because the professional athletes often have time off or season off. And so this kind of model is really unsustainable, and kids either fall off because they can't keep up, they're not perceived to be as good, or they get hurt, or all of the above. So we see a huge increase in injuries. One of the injuries we see the most of is overuse-related injuries, just simply from doing too much. And if you ask pediatricians who work in clinics 20 years ago how many of the injuries they see go into their clinic as a result of overuse, they might have said 10, 15%. These days, you often hear 60, 70, 80% of the kids coming into the clinic are simply because they're working too much. They're doing too much too often, not enough rest and recovery. So there's a huge problem. We've seen a doubling of overuse-related stress fractures in kids, for example, in the last 10 years. And a number of other things. Their bodies are immature, and right about the time that if a kid's going to be any good or perceived as any good in a sport, 12, 13 years old, you start really overloading them with plyometrics and supplemental training, and that's really physiologically one of the worst times to be doing that. They're very vulnerable to a lot of injuries. And again, the specialization really lends itself to overuse because you're just doing the same thing again and again versus getting a diversity of exposure. So what do we do about it? What needs to change? The message, one of the messages we want to do, and others have done as well, is promote, is that athletic development and success takes time. There's no sense of urgency. You don't have to be a world champion at 12. What we really care about is if you're still playing and competing and being active at 18 and as an adult. So it takes time, and it should be a diversified, balanced, progressive exposure, not something where you pick real early and just do the same thing over and over again. There should be more of a concern about being an athlete and moving well, balance, endurance, optimally functional versus performance. And if you do that and spend more time on developing this as an athlete, that pays huge dividends later, rather than worrying so much about performance. Injury history is one of the biggest predictors of subsequent injury. There's too many kids out there who are playing hurt. And the reason they're playing hurt is because they feel like, gee, I can't miss a practice. I can't miss a game. I've got to be in there. So if they get hurt, they're coming back too soon. And that may be pushed by the parents, may be pushed by the young athlete, it may be pushed by the coach. But it's critical that if a child is hurt, full recovery, full rehabilitation must occur before they get back out on the field. It doesn't matter if you miss a practice or a week or 2 weeks or whatever. Sometimes some of the best performances have come when kids have been hurt and they stayed off for a while, or they were ill and they come back and they light it up because they're well rested. And you have to fix the problems. If there's some biomechanical problem or some technique problem, that has to be corrected, because if you just go back doing the same thing or some kind of training program that's overloading them, you've got a problem. So you must address these things. Rest and recovery is critical. This is one of the biggest training errors, competition errors we see with kids. They don't have enough time off between training sessions, between tournaments, even between games within a tournament. And so sometimes there's only an hour between multiple matches. My kids both played tennis at a pretty high level. It wasn't unusual for them to play a 3-hour match, have 1 hour off, another 2-hour match, 1 hour off, another 2 or 3 hour match, and then if they won, they do it the next day. And in soccer, it's sometimes very similar to that. If there's a longer recovery, you're allowing the positive adaptations to occur, you're reducing their injury risk, you're minimizing the carryover effect, and the responsibility for this has to fall on not the kids, but the adults, the coaches, the sport governing bodies, the associations, the event directors, and certainly the parents. So the message is, you know, there's 50 million kids, as the congressman said, that are involved in community sports in one way or another across the country. If you look at the high school level, there's 8 million boys and girls that play sports in high school across the United States. If you look at Division I, II, and III NCAA combined, there's 440,000. That's 5%. So all this stuff, well, why are you working so hard? Why are you training like a pro? We're going to get a college scholarship. No, you're not. 95% of the kids will never walk on the field unless they got a ticket in their hand. And so there's only room for 5%, never mind the international recruitments that go on. And so you're not training them for that. And certainly, to be a professional, I put 0.1%. It's usually less than that. The kids that go from high school to professional athlete is minimal. So you need to think long-term. You need to think progressive. You need to think participation in sports is for some other reason than playing in college or certainly professional. Minimize the preventable injuries. Overuse is one of them that you can certainly minimize. Keep it fun. It's got to be fun. If these kids aren't having fun, they're going to quit. The last message that I want to leave you with is, you know, if we do it right, it really can be a foundation for life. And if they're, you know, rather than being a public health problem, we've now used the phrase, maybe youth sports can be part of the public health solution. And so we'd like to see it that way. I want to say a few words because Art asked me to say a couple things. So I have a couple notes I just want to say about the Nike Design to Move because we're going to hopefully hear more about that. You know, Nike, I don't know if you saw that commercial that they ran last year with the boy jogging down the path. He's kind of a heavy kid. And that's remarkable for Nike to show that. They usually show Michael Jordan and athletes like that. But what they've done is they've recognized what all of you have recognized, is that physical activity is decreasing and the impact, the negative impact and the cost is increasing. So they're trying to do something about that. And they see this as an opportunity, but the science is really clear, the benefits of physical activity. Now, we would all say, well, academic achievement improves, you know, cardiovascular fitness improves, blood lipids, you know, profile is better. The way Nike says it is that regular physical activity unleashes the human potential. They say it a little more colorfully than all of us. So they see a critical window, and they want to put the focus on kids. So there's two asks that Nike has in their Design to Move program. Ask number one is that they want to create it, all of us stakeholders, create a early positive experience for children getting into sports. The second ask is that to integrate physical activity into everyday life. Now this is no different than what everyone's been saying in the last couple of days, right? Why is it so different that Nike's saying it? Well, Nike's voice is heard, and Nike can be a powerful ally for a number of reasons. What is ACSM's involvement right now? Well, ACSM helped Nike when they unveiled their Design to Move program last year at the Clinton Global Initiative in New York City. And since then, ACSM had Nike at their annual meeting last year in Indianapolis to present this program. And on Monday, this coming Monday, the Nike folks are going to be at the ACSM national office to talk about partnership opportunities and what the next steps are. So they've been Nike's been sort of under the radar a little bit with this because they're trying to see who their partners are and what the alignment's going to be. But I think it's going to be a strong advocate for what we're all trying to do. And I think it's nice to have their voice be among our voices as we're trying to promote physical activity. So again, thank you very much, and I look forward to the next talks.